here has seen Barbie? All right, so for like the 3 of you who haven't, minor spoiler alert, but in the movie, Barbie learns that unlike in Barbie Land, where women are in control, the real world can often be a cruel and unwelcoming place for women. Fast forward to the end of the movie, you see Barbie, she's all dressed up in a blazer, she's looking bold, she's looking optimistic. She walks into an nondescript office and proudly states, "I'm here to see my gynecologist." The movie ends and an uncomfortable giggle ripples through the theater. Because as any woman in this room knows, out of all the harsh realities that Barbie was forced to face, the harshest might in fact be the gynecologist. Because even women's health has been designed without consideration for the woman's experience. For far too long, women have been an afterthought when it comes to healthcare. In fact, it wasn't until 1993 that women were required to be a part of clinical studies. I'll repeat that, because it's shocking. It wasn't until 1993, 30 years ago, that it was required to understand how drugs and medical devices worked in a woman's body versus only a man's. For far too long, the rooms making decisions about healthcare have looked like this, which is an actual photo of lawmakers discussing a bill to diminish maternal health benefits. If we want women to be healthy, if we want to engage them in their health, we have to design for and with women. And that's what we're doing at Teal Health, the company I'm building. And we're starting with one of the most disliked yet critical aspects of women's health, the cervical cancer screening, often referred to as the pap smear. Here we go. The pap smear is done with this tool, and it looks exactly how it feels. It is cold, it is hard, it is large. It is uncomfortable at best and extremely painful at worst. And it's done in a doctor's office where the doctor has you scooch, 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 scooch until you're all but dangling from the edge of an exam table. Your legs are in stirrups, you're exposed, you are vulnerable. You are waiting for that speculum to be inserted, opened, and have cells scraped from your cervix. Now can you see why I'm a little worried about Barbie and those 92 million other women in the US who should be regularly screened for cervical cancer? Is it any surprise that 1/3 of women are not up to date on their screening when this is the experience they're expecting? However, when cervical cancer is caught early, it is nearly 100% treatable. Yet in the United States, we have 200,000 women living with cervical cancer, and over half of all new cases are with women who are behind on their screening. Luckily, due to advancements in screening assays, we can actually ditch the speculum and allow women to comfortably and privately collect in their own home. And so that is what we're doing. We are creating the first at-home cervical cancer screening, and we're bringing it through the FDA right now. We've tested it, thank you. We've tested it in over 215 women and shown that not only can we collect an adequate sample, but we also are able to, it's much preferred, and increase screenings. 87% of women in our pilot study said they'd be more likely to be screened if Teal was an option. 97% said it was easy or very easy to use, and on average, it took less than 2 minutes to collect the sample. But it's more than just cervical cancer. It's more than just a collection. What we're building is a women's health platform that is inclusive, that is honest, that honors just how powerful and capable women and their bodies are. If we listen to women, if we meet them where they are, if we build something that's responsive to them and their needs, we can build a world where nobody has to encounter barriers, fear, shame, or bias in order to take care of themselves. Thank you.